Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. It's always good to have you on the show. Today we are looking at the field of epidemiology. This field of medicine plays a vital role in protecting the health of populations. In recent times, they've helped to advance global health security around the world. Today we'll look at how to enhance this field of medicine and to ensure that disease surveillance is not just put at the lowest form but at a high peak. Stay tuned, the conversation begins in a moment.
We work hard to keep our communities safe and healthy.
We work to strengthen service delivery so people receive high-quality care.
We work to create and strengthen surveillance systems that detect public health threats.
We collect and analyze data for evidence-based decision-making.
And we respond.
We go where we have to go and do what we have to do
to make sure we leave no one behind.
We vaccinate people, test and treat people,
and protect people from the impacts of public health emergencies.
We work with communities to educate and empower people
to protect themselves and their families' health.
We've been on the front line of this pandemic response from day one.
And we're still here, and we will continue to serve our communities.
We are field epidemiologists.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Charles Emejuru, Assistant Director, Federal Ministry of Agriculture and Rural Development. He is also a field epidemiologist. Good evening, Dr. Emejuru.
Good evening, Modupe. Thank you for having me.
All right, thanks for joining us. To start with, let us look at the field of epidemiology. If you are to rate epidemiologists and their roles in Nigeria, how would you rate them?
Thank you very much, Modupe. While I would say that it's not easy to rate yourself, but if I'm to judged by the responses of the international community and Nigerians themselves, especially the role and the work done by field epidemiologists during the 2014 Ebola virus disease outbreak. The field epidemiologists were at the forefront of ensuring that Ebola virus disease did not spread beyond the very few cases that we had in 2014. And in fact, Nigeria got international acclaim for responding swiftly to the Ebola virus disease. Also, when we hear every day of COVID-19 response and a response to monkeypox, response to Lassa fever virus, from the NCDC. At the forefront of these responses are field epidemiologists. So they have been able to ensure timely response to disease outbreaks and ensure proper surveillance of all these diseases. Yes, we will not say that we have reached the promised land. There's always room for improvement, but within the surveillance public health systems that we find ourselves in, we're a developing country. I would rate field epidemiologists quite high. But as I said, there's still room for improvement.
All right. Can you say the same for genomic sequencing? Do experts in the field of genomic sequencing, do they play the same role with that of epidemiologists now? If you have to place them side by side.
Well, genomic sequencing is a part of epidemiology as a whole. It's mostly laboratory work. I'm aware that the Nigeria Center for Disease Control has a very dependable whole genome sequencing lab, and also the University of Ibadan, also the National Veterinary Research Institute. They all have very good genomic sequencing laboratories and have highly qualified personnel for genomic sequencing. However, like I said before, there's always room for improvement. Genomic sequencing costs a lot of money, and it needs highly trained staff. So in the area of antimicrobial resistant pathogens, I'm aware that the NCDC is carrying out a lot of genomic sequencing. There also the National Veterinary Research Institute, and also the NCDC also carries out genomic sequencing for public health pathogens. So the work has started, the personnel are on ground, but there's still much needed to link all the labs and have more labs carrying out genomic sequencing.
All right, before we get to the funding and equipping of all these labs, how do we ensure that disease surveillance is at par with disease outbreak? Because fine, it's not enough to put the labs in place. How do we utilize these labs? How do we enhance the services? Especially now that we have diseases emerging.
How we utilize the labs?
Yes.
So in disease response, in disease outbreak investigation, the laboratory network is essential, because when we go out to investigate disease outbreaks, we take samples, either from humans or animals, or sometimes even from the environment, and these samples are taken to the laboratory in the NCDC, in the National Veterinary Research Institute, BOM, and other labs. And so we cannot, the work of outbreak investigation and the work of field epidemiologists do cannot be done without having a good network of laboratories. And Nigeria does have a good network of laboratories, but as I said before, there still needs to be some better linkages of the various geopolitical zones in the country when it comes to laboratory surveillance.
All right. If you're to look at the workflow you just narrated now, the gap between the labs, the primary healthcare systems, the gap is just too far. How do you think we can domesticate services of the genomists as well as epidemiologists at the primary healthcare levels?
Well, right now, there's already a linkage between the primary health level and the laboratories. Like I said before, when it comes to all public health diseases like measles, Lassa fever, monkeypox, cerebrospinal meningitis, all these diseases occur at the primary health level, at the community level. And they have disease surveillance and notification officers who take samples from these people from the community levels and take up to the reference laboratory at the NDC for proper diagnosis. So there's already linkages, but as we keep on saying, there's always room for improvement. in any surveillance system.
Okay, what about swift response in terms of disease surveillance, release of results? Because I know during the time of COVID-19, many people had issues with getting results due to low collation of results, testings, and all that. How do we bridge the response time?
Well, COVID-19 was or is a pandemic, and it's a disease that took, I guess, the whole world unawares, and Nigeria is not an exception to that. And Nigeria is a very big country, and Nigeria has a lot of people who want to travel, and so a lot of samples needed to be run and run appropriately. So initially, 2020 especially, there were teething problems, teething issues. But along the line, I'm aware that those problems were resolved. The turnaround time became quicker. Sometimes the problem may not arise from the authorities like the NCDC. Sometimes it is the clients, those who are coming for testing, that come with some challenges. But by and large, I would say right now, if you want to test for COVID, the turnaround time is pretty swift, especially as a network of private laboratories are also part of the testing.
All right, apart from the need for increased investment as well as funding now, how do you tell young graduates out there, how do you enlighten them on the need to, embrace this field of medicine? Because it's obvious that we don't have more hands in that aspect.
Is it medicine or field epidemiology now?
Epidemiology.
Because,
Epidemiology.
yeah, if it is field epidemiology is a very unique training program that encourages medical doctors, veterinary doctors, laboratory scientists who work in the public sector, especially, to come into. So if you have a background in any of these professions I've just mentioned, you can always enroll for the field epidemiology and training program. The program it takes 2 years to cover, and within the 2 years, 25% of the time will be for lectures, and 75% of the time you will have very long field placements at specific public health offices, so that you carry out have hands-on experience in outbreak investigation, etc. So Nigeria currently has roughly 430 field epidemiologists out of the population of 200 million. The WHO says that every country should have minimum one field epidemiologist to 200,000 people.
Wow.
So you see that for now we're still far behind that. So until we get to like 1,000 and 1,000 and above field epidemiologists, before we can say we have arrived. So we encourage medical doctors, veterinary doctors, laboratory scientists, environmental health officers to embrace the profession.
All right, Dr. Emejuru, thanks for that detailed explanation. The world is no longer a global village, and collaboration is of utmost priority now. What are we doing in terms of collaboration, partnership with advanced countries?
Thank you very much for that question. Like you rightly said, the world is a global village. Like we have seen in the case of COVID-19, any disease occurring in any part of the world can spread to the four corners of the world. We have seen that also in the case of monkeypox. So collaborations are key. We in field epidemiology, we always promote the One Health collaborative concept. The One Health concept is an approach, a multidisciplinary approach to solving public health events. So we take in the animal health sector, the human health sector, the environmental sector, we bring them into a team to collaborate together, because we have found out that 75% of emerging diseases around the world are of animal origin, talking about COVID-19, monkeypox, Ebola, avian influenza. And of course, we are expecting the next pandemic to happen anytime, so it must happen, whether we like it or not. So multidisciplinary collaborations are key. International collaborations, the NCDC, Federal Ministry of Health, Federal Ministry of Agriculture and Rural Development always partner with US CDC, Africa CDC, WHO, World Animal Health Organization. These international partners continually support us in Nigeria in the work we do, knowing fully well that if they can stem the spread of the disease when it starts in any country like Nigeria, it's also protecting them in Europe or in America, because whether we like it or not, Nigerians travel a lot, diseases spread, so the disease can spread from Nigeria to Europe, or from even Europe back to Nigeria. So collaborations are very key, and there are a lot of collaborations on board.
Dr. Charles Emejuru, your call to action as we wrap up this segment.
Sorry, I didn't get your question. Well, as we on the 7th of September, we marked the Field Epidemiology Day. And the Field Epidemiology Day started last year, and we're marking the second anniversary of that day. So my call of action would be that we need to recognize the work that field epidemiologists do in ensuring that disease outbreaks do not spread and no deaths in our communities. We want the government and the people to appreciate the work that we do. And we are calling on the government also, in as much as they have done a lot for field epidemiology, to continue to do more in providing support to the field epidemiology training program of Nigeria through the NCDC, Federal Ministry of Health, and Federal Ministry of Agriculture. We also want the government to continue to train and retrain field epidemiologists to be capable in handling disease threats anywhere they occur in Nigeria. So that is my call to action in respect of the Field Epidemiologists Day.
Increased funding, training, as well as empowerment of professionals in the field will actually increase surveillance and protect the population from disease outbreak. Dr. Charles Emejuru, Assistant Director, Federal Ministry of Agriculture and Rural Development, thank you so much for your time on Sound Health this evening.
Thank you very much for having me.
All right, I have been speaking with Dr. Charles Emejuru, Assistant Director, Federal Ministry of Agriculture and Rural Development. He is also a field epidemiologist. He has been speaking with us on the role of epidemiologists in advancing global health security. Sound Health continues with trending health reports from around the world. Please stay tuned. right, this is where we say thank you on today's episode of Sound Health. Remember, we all have a key role to play in the spread and control of diseases. Protect yourself and your loved ones. Wash your hands for at least 20 seconds with soap and water or alcohol-based hand sanitizer. You also need to get vaccinated. The vaccines are free, safe, and harmless. Join me again next week, but before then, send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth for all your comments and inquiries. A sound health is a sound mind. Make healthy living your choice.